Now, this meditation, we believe, can help a lot of people. And it's important to understand exactly how it affects stress, which of course impacts our physiology, and in particular, how TM reduces stress and stress-related disorders. So I'm going to walk you through a couple important tips. This first image is my office. And like many of you, I sit in my office day in and day out thinking about what the heck am I doing wrong. Makes me churning up the waters, so I'm on that surface in that ripply water in a canoe and not doing so well. So let me explain to you, because I'm a heart surgeon, how I see stress in the heart. And this is an animation that I think will bring it alive pretty nicely. This is the middle of the heart. See if it's ruptured, that little plaque that cracked? That plaque that cracked leaves a raw surface on the inside of the heart vessel, and that vessel starts to heal itself over. It puts a scab on it, and that scab gets larger and larger like you would anywhere in the body, but in the heart, it does something catastrophic. Kaboom! Right there, it closes over the artery. And when it closes over the artery, what you just saw was a leading cause of death in the Western world. Now, what can Transcendental Meditation do about that? It's a remarkable process. I'll show it to you real quick again. You've got a scab inside the artery, a plaque ruptures, and it's not the plaque that kills you. It's the scab on top of it. And that arterial surface, that lumen, that tube that's carrying life-sustaining blood, in this case to the major vessel of your artery, is what causes death. Now, let's scroll forward and talk a little bit about how it works. If you look at what it fundamentally does, Transcendental Meditation, this is a study done with subjects with high blood cholesterol. It's a one-year study looking at people who practiced TM for that year. And it was associated with a significant reduction in total cholesterol by about 10%. That's 30 millimeters of cholesterol. Now, if you're on a medication for cholesterol, we hope you can get 30 millimeters lower in your blood cholesterol. Well, this happened through Transcendental Meditation alone. Cholesterol is the first big risk factor we talk about with heart disease. The second big risk factor, this is a randomized clinical trial finding improvement in the levels of insulin resistance, glucose, even insulin levels themselves in over 100 people who had coronary blockages after just 4 months, 16 weeks of TM practice. Dramatic changes reflected that were significantly greater than just teaching people about their health. That's the second part of the problem we have with heart disease, which is diabetes. The third big one, but this one, by the way, was funded by the NIH. So it's a reputable organization supporting this work. The next study looked at a randomized trial of hypertension sufferers, people with high blood pressure, showing that Transcendental Meditation produced significant reductions in systolic and diastolic, the high number and the low number of the blood pressure, of 11 and 6 millimeters respectively. Those are big numbers. We don't get that kind of result all the time with medications. Now, those three things, high cholesterol, high blood pressure, and high blood sugar, those three things drive heart disease. And this last image is probably, for me, the most important. This is an image looking at Transcendental Meditation effects on reducing mortality, heart disease, and stroke. By how much? By 47%. It was a long-term randomized trial in older African-American patients with coronary disease. This kind of a stunning impact, unimaginable in the Transcendental Meditation group. And when you talk about all causes of death, and you can reduce them by that much, as well as non-fatal strokes and non-fatal heart attacks, these are spectacularly large impacts. Now, that's the data. That's the hard data about how we can get people to live longer and live better. Now, let's talk about one other little issue of vanity. Obesity. Could it potentially impact on weight loss? So loss of weight, in theory, is a pretty reasonable thing to expect if you can reduce stress. Because what is chronic stress? Fundamentally, chronic stress 1,000 years ago was not a deadline. Fundamentally, chronic stress is famine. It's not having enough food. That's what used to cause us to get stressed out. So what happens when you get stressed? You immediately upregulate these chemicals in the brain called cannabinoids. Sound familiar? Like cannabis? You turn them on, it's like you're smoking pot. You get the munchies. So you eat more foods that you don't even like, and you keep eating them throughout the day even if you're not hungry. Which is, of course, if you were starving 1,000 years ago, what you wanted to do. So let me explain what happens with this animation. Exactly. Now, this is an animation showing the liver at the top there, and the bile, the little material from the intestines going up to the liver. The liver, if it's poisoned with the wrong kind of food, leads to a fatty surface as you see here. And that fatty surface leads ultimately to this yellow pad called the omentum. See, it pulls ponderously large across your belly as you put on belly fat. When I look at belly fat, what I think is a stressed out person. Because we accumulate belly fat for a very particular reason. That belly fat accumulates because it's a receptor for steroids of the body. And the cortisol released, the stress hormones released when you are stressed out, will accumulate. They get sucked up in the belly fat. Why? Because if you can accumulate belly fat, again 1,000 years ago, you could mainline it to your liver. You could quickly shove it into your body if you were starving. So our ancestors desperately needed this protective mechanism. We don't need it anymore. Now, the anxiety that I'm talking about that leads to overeating and many other problems paralyzes the ability of its sufferers to function normally. We've all experienced that. But I want to talk a little bit now about the symptoms of post-traumatic stress disorder, which are not just prevalent in the people who have fought in battle and come back from combat, but in young children growing up in our inner cities, in war-torn regions of the world. It's also exhibited in post-traumatic stress disorder type phenomenon with severe anxiety, depression, violent behavior, impulsive behavior, and we have to equip our youth with tools to cope with this. As we do have to equip the homeless, impoverished individuals living on reservations across this country, they need the tools to be able to cope with the traumatic stress of their lives. And this is where the good works of the David Lynch Foundation come in, because that's what they're focusing on. They're working with people who are most at risk for traumatic stress.